And we go back to this evening's health report now, where Shamela Pullen looks at cervical cancer.
Cervical cancer is fairly common in Jamaica. It begins when unusual cells grow in the cervix.
So cervical cancer in and of itself is a cancer of the cervix. Now the cervix is the neck of the womb. And the neck of the womb is the entrance to the uterine cavity where the baby is usually formed. And so it is caused by a virus, right, which is called the human papillomavirus, the HPV virus. There are over 250 strains of HPV, but of those strains, we have about 4 or 5 strains that are considered what we call pathological, which can cause cancer.
Cervical cancer can affect all women. It's mainly caused by having unprotected sex with a male partner carrying the HPV virus. The cancer does not often show early signs or symptoms.
Some of the earlier warning signs would include, for example, painful sexual intercourse. So if you experience a lot of pain during sexual intercourse, or you experience spotting after having sex, or abnormal vaginal bleeding, especially that bloody water kind of vaginal discharge, this would indicate that the cervix may be unhealthy. Of course, cervical cancer may present as a form of pelvic inflammatory disease in that the patient has low abdominal pain and discomfort with abnormal discharge.
Cervical cancer can be detected early through screening with a pap smear. Treatment is often done through surgery, depending on the stage of the cancer.
Once we've identified cancer cells, we want to get them out. The issue, though, is that we don't want to wait until cancer cells appear. Because of the pap smear screening, these allow us to identify what we call precursor cells or pre-cancer cells, that if they are identified, that patient is at a very high risk of developing cancer within the next 2 to 5 years. So ideally, every woman over the age of 21 should be screening, because ideally you screen quote-unquote healthy individuals who may be at risk, and that would identify these pre-cancer cells early, and we can completely eliminate these cells before it gets to cancer.
So don't wait. Get your pap smear done. Early testing can prevent serious health problems. With your health report, I'm Shamela Pullen, wishing you good health.